And welcome to the COVID-19 Task Force Daily Update. I'm Joe Delarone. We have a very busy show today. We have 4 guests and again, some news. We'll start off with Chief Peacekeeper Dwayne Zachary. He's not going to be here too long. He wants to get right to the point. So without any further ado, Dwayne.
Thank you. Good afternoon, Kahnawake. So I just wanted to come on and do some quick updates, maybe give some information, and maybe a shout out, to the people who are still working really hard to socially distance and follow all of the directives. Anyway, what I wanted to talk about today was Kahnawake peacekeepers have noticed that there's an increase in people not respecting the highway safety, right? We have lots of people out there walking, lots of people out in the community. Please be aware that they're out there. You have to stop at stop signs, right? Don't just pull through them. It says stop. It doesn't say slow down. Stop, all right? Obey the traffic laws. Obey the traffic rules. It's imperative. We don't need any other emergencies in our community at this time. I wanted to make the community aware that in other areas in the province of Quebec, the Sûreté de Québec will be doing checkpoints, right? And the checkpoints are to ensure that only essential people are going in and out of certain areas. It's not close to us, but I wanted to make you aware because as this COVID emergency develops and goes longer, I think we'll start to see additional measures come closer to our area. So please be aware of that. Ontario border, I just got this information now. It's going to be closed. Only essential travel from Quebec to Ontario and back. Only essential travel. So right now in the province of Quebec, essential travel is this. If you work for an essential service, if you're transporting commercial goods, and you have to have all of the permits for that, if you are doing essential work, right, medical, that type of thing, if it's for humanitarian reasons, if you're a volunteer for one of the humanitarian units, I guess, or hospital, that type of thing, if you have to travel for medical emergencies, if there's no hospital or pharmacy in your area, you're allowed to go through different areas. And the last thing is, if you get to a checkpoint, it'll be police discretion. What that means is the police officer that you're dealing with, he or she will make the final decision on whether or not you can pass. So it is what it is at this point, right? It doesn't matter who you are or where you're coming from. The police officers at those checkpoints will make a determination based on the information that you give them at the time. Okay, so please be aware of that. So at this point, that's the information for the province of Quebec. I don't have all of the details for Ontario yet. When I do have it, I'll definitely make sure that you are aware and that you have it. But please be aware, Ontario border starting tomorrow will be closed. It'll only be open for essential travel. What I wanted to also let people know is I get lots of emails, hundreds of emails a day from different units within the territory, right? KTV, the COVID task force, you name it. I get lots of emails, and some people are reporting their issues to those to the emails essentially. If you need to make a complaint or you need to call the peacekeepers or report a crime, you have to call the peacekeeper dispatch, right? 450-632-6505. Okay? And that's it for me for today, but I wanted to let you know, Kahnawake, for those of you that are doing all the things that you need to do to mitigate COVID-19, congratulations. Everyone else, smarten up. We got to start working together. Now.
Now, Dwayne, a man who speaks from the heart. And just when you think there's no news, there's always news. And Lisa Westaway, the Executive Director of the Cattery Memorial Hospital Centre, joins us. And once again, there's some news, so if we can welcome her along with her new hairstyle for today. Lisa, it's all yours.
Someone told me I had to change my look up a little, so I straightened my hair this morning. Okay, so we have just a few updates. The first is I wanted to talk a little bit about the testing site. So just before coming here today, I received an email. There's been a provincial change happening to all the testing sites as a result of the increase in tests that are happening across the province. So in order to better explain this, basically they are unable to process all of the tests that they have in the time frame that they need to complete the testing, and therefore, as Dr. Gauthier mentioned to you last week, she explained the testing procedure a little bit. If the test is not processed in adequate time frame, it could have an impact to the validity of the results, and therefore they want to give the labs some space and some time to be able to process all the tests that they have right now, and for that reason, for the next 48 hours, they are closing down the testing sites across the province. So they are going to continue to test certain groups, and so I'll tell you how they're prioritizing the next couple of days. They will continue to test essential service workers that are related to the healthcare field. So in our case, for KMHC, for KSCS, for the fire brigade, and for the peacekeepers, anybody who develops symptoms in one of those 4 areas will be able to be tested, and so we urge you to contact our KMHC phone number to get an appointment. Also, we have they will continue to prioritize inpatients. So we do not have any inpatient, any residents who have symptoms at this time. We do not have a need for testing in our inpatient at KMHC, nor at the Elders Lodge at this time. Those 2 locations will also be prioritized over the next couple of days. So again, even though the testing site is closed for the next 48 hours, they will continue to test anybody who develops symptoms within the Elders Lodge, within KMHC inpatient, KMHC staff, KSCS staff, fire brigade staff, and peacekeeper staff. So one way to look at this, we've, just to let you know, we've tested 60 people over the last few days. We have 3 people booked tomorrow. Those we will continue, we will still test because they're already booked. So that's a total of 63 tests that have been done in the last 3 days. We don't have those results yet, but we do know that there were quite a few people who went to other testing centers around the community, whether in Valleyfield, Saint-Jean, Châteauguay, and yet we do not have any new positive cases. So this is really positive news, and the fact that we've tested 60 people tells me that we've reached quite a few people in the community. Of course, not a big percentage, but it's hard to say exactly what the percentage of people who have symptoms who are not being tested is. But I'm very pleased with the number of 60 that we've had up till now. And in a couple of days, I hope to be back here encouraging you to be tested if you develop symptoms, because as we've said, there's a reason for this testing, and it's really to be able to contain as much as possible and ensure the self-isolation. One thing that I wanted to remind you of, and this is something we haven't really talked about specifically, is that if you are positive and you're living in a home with other people, remember what self-isolation means. So I would suggest that you go back to our website and you look at the recommendations for self-isolation. So if you're in a family, a household, we'll say a household of 4 people, and one person is positive, you can't assume that because you've had contact with the other 3 members that they will all be positive and you don't need to self-isolate. That's not true, and that's not what we're seeing in reality. In fact, what we're seeing is that even though there's one member in the family that's positive, others in the family that were tested are negative. So it's very, very important that if you're positive in your family, you completely self-isolate from the rest of your family. That includes your children, that includes your spouse. You should be in your own location with your own bathroom as much as possible in order to avoid the others being impacted. So it's just a little clarification that I wanted to make. And again, I urge you to look at the self-isolation procedures that you received when you did your test, but that are also on our website. What I really wanted to talk about today was about inpatient, because I haven't given that a lot of time in my talks, and I know that there are many loved ones who are worried about the safety of their family members, and they're unable to see them. So I wanted to just give you a little bit more detail about some of the measures we were implementing to ensure their safety. So I think many of you have probably received phone calls. We will continue to call you to let you know how your loved ones are doing on a regular basis. We have staff that are dedicating their time to that. We also make changes to the structure of our inpatient units depending on the recommendations from public health. So the other assurance I want to give you is that we stay very up to date with public health recommendations, and we implement those recommendations as they come in, whether it be daily, whether it be weekly, and as you know and as you've seen, information changes, research and science changes, and therefore we do get new recommendations. So we do not, and I know I said it earlier, but we do not have any positive cases on inpatient, and we do not have any residents who are suspect cases either at this point. And our goal is to keep it that way as much as possible. And again, when I speak about inpatient, I'm also speaking about the Elders Lodge. There are no residents at both of those facilities who are suspect cases or positive cases at this point. And again, our goal is to keep it that way as much as we can. So you already know that residents are not allowed to have visitors. That was implemented quite some time ago. Some things that are new in the hospital is that disinfection procedures have been increased beyond our usual level, and so extra training has been provided to staff. We no longer have eating in the dining area, so we have a tray service. It's been implemented for all meals with all the safety precautions that surround providing food, and anybody who requires one-on-one assistance for feeding does receive that. We have certain new isolation precautions already being taken into account should one of the residents develops COVID-like symptoms, and therefore we are able, in the past we were having someone, we would have to have someone come in from another establishment to test, but now our nurses are able to test any possible cases, which means that testing will be done more quickly. We also have reorganized space so that we have an isolated space available for any potential positive patients. And everyone will be cared for by a specialized team who are specifically dedicated to positive COVID patients. So we don't have the need for use of that isolated space at this point, but we're already prepared should the need arise in the future. So I hope that on our website and in the newspapers, possibly this weekend, we may be able to give you some nice messages from your loved ones, from inpatient. We're just working on that, and I hope it will be ready in time. But I do want to assure you that we're doing everything that we need to do and everything that is humanly possible to ensure that the residents are safe and well cared for, and that they don't, we limit as much as possible the isolation that they feel in not being able to see their families. So I hope that this has been helpful to you. It was really important that I give you that information. And of course, if there's ever anything that you need, then please do not hesitate to call. If you want to speak with your loved one, you can always call the nursing station if they don't have a phone in their room, and we will make sure to put you in contact with your loved one. Thank you.
Thank you very much, Lisa. And again, all the work being done for our elders. There's more to report on that front, because joining us now for the first time on this daily update is Ashlyn Phillips. She's the Emergency Food Service Coordinator working out of Kahnawake, yet again has community services, and she'll explain all of the initiatives that are now underway to help those 60 and over. Ashlyn?
All right, so good day, everyone. First off, I just want to thank the COVID-19 task force for having me here and allowing me to provide the community with a little bit more information about what the emergency food service has to offer. So just a little background, the emergency, in any given emergency situation in the community, KSCS is responsible for maintaining food, shelter, and clothing to community members. So in this situation in particular, the focus falls on the food. And a little over 2 weeks ago, with the increase of information coming forward about the COVID-19 virus, both worldwide but more important locally, KSCS initiated their responsibility to provide whichever service was needed. And in this case, food was and still remains at the forefront of the responsibilities. So under regular circumstances, I'm the team leader of kitchen services at the Turtle Bay Elders Lodge. So it made sense for me to help out and help coordinate this for KSCS. The emergency food service, if people have been hearing about it for some time now, but just to make things a little bit more clear to everybody, it is broken down into 2 channels of service. So those being prepared meals and also food distribution to the community. And as people may be aware, the prepared meals are being facilitated through the rail. We are making our priority for prepared meals the population of the community who are ages 60 and over. And this is due to the mandate of having people remain at home as much as possible during the pandemic. We are also looking at those who do not have a means to prepare meals at home, and particularly those who are affected by the COVID-19 virus. So the prepared meals are being delivered daily. We're doing 2 meals delivered at once, so we are delivering both lunch and supper at the same time. This just helps facilitate the delivery process. And these deliveries are being made by medical transport. So at this time, we are asking any recipients just to be patient as deliveries may take a little bit longer than expected, because we are currently servicing over 90 clients each day, and we do have 4 delivery vans, and we are expecting that number to grow. So we are just asking people if they can please be patient on that front. We are doing our best to help out with their needs. So the second branch is the food distribution portion, and that is being operated out of Cattery School, and that's in conjunction with the Cattery Food Basket. And we are preparing boxes containing anything from dry goods to fresh produce and fresh meats whenever possible, any type of food items to help out the community. And these items are being distributed as well by medical transportation. Anybody who wishes to make any food donations can do so at Cattery School Monday to Friday between the hours of 10 and 2 p.m. Community members who are eligible to receive the food distribution service are primarily those who are affected financially due to the COVID-19 virus. And this would be anybody who may be lost employment due to business closures. So that is our priority for the food distribution. To access either of these branches of the emergency food service, eligible community members are being asked to contact KSCS at 450-632-6880 and ask to speak the emergency food intake. So just as I had already mentioned, but just to go into it a little bit further, the emergency food service is still in its infancy, and we are developing improvements and adjustments day after day. We are encountering glitches, as this is a new operation, as it would be with any operation. So we are constantly working out the kinks to ensure that the service is as close to flawless as possible. So during this time, we are just asking community members to please be patient with us. We understand that the need for food is a necessity, but there is a lot of moving parts and a lot of different aspects to take into consideration on our part. A lot of KSCS's non-essential service have been placed onto this project, and everyone is learning and adapting on a day-to-day basis. And our numbers are increasing daily, and we are looking to make this food service last as long as possible, as we don't know how long the pandemic will last. So we are asking those who believe they require the service to really think about their options before giving us a call and seeking our assistance. We are here to provide a service to the community, and we will. However, we do need to assess the eligibility of the community members prior. And just to close up, I just want to thank the community for their patience and understanding, as this is our new operation. And I also want to thank the emergency food service team, the volunteers, Cattery Food Basket, medical transport, the rail, and anybody else who was involved. Now I'll go up.
All right, now Ashlan, very good job. By the way, just a little add-on to that, a reminder that don't call the medical transport for food deliveries or anything like that. Just call the 632-6880 number. And our final presenter on today's update is Lloyd Phillips. That was his daughter, by the way. Is Lloyd very proud here? I hope you'll say a couple of nice words about the job she did. But Lloyd will wrap things up today on this last day of March.
Thank you, Joe. Thank you, Ashlan. Yeah, certainly tough act to follow. I'm certainly proud that she's stepping up to the challenges, and I hope I had at least a little bit to do with that at this point. So usually I'm on first. Today I decided I'll wrap up the show with this some overall updates. And look at some of the numbers and some of the stuff looking forward. Well, first and foremost, I want to start off by saying that as the chair and the leader of the COVID task force, along with Lisa Westaway, I couldn't be more proud of the response of the task force in this time of need in the community. There are several directives that were issued over the past few weeks, and each sector that was given a task to do has done a phenomenal job of making sure that directive is followed, again, to assist our community in this time of need. And it also goes out to the business people who are directly impacted by some of the directives, have also stepped up to the plate and have really shown community spirit. So I just wanted to mention that because I'm very proud of not only the task force response, but the whole community response. And as Dwayne mentioned earlier, yeah, there are a few people who are bucking the system, but vast majority of Kahnawake don't realize that we're all in this together, and the only way that we're going to get through this is to stick together. So currently there is 4,162 cases in the province of Quebec. There is 341 cases within the region called the Montérégie, which is surrounding Kahnawake area. However, there is nearly 2,000 cases in Montreal. So a significant amount of those numbers come from the island of Montreal. That's why in previous discussions, it was highly recommended that you don't go to the island of Montreal unless you absolutely have to. Stick locally as much as possible, shop Kahnawake as much as possible, and if you have to go out of the community, again, essential services only, and go as close as you possibly can go, and then return back as quickly as you can. Because, as I said again, sometimes I feel like I'm repeating myself, and I said that several times already, but according to some of the experts, it's going to be about 2 weeks before we could give a prediction of how long we're going to be in this for. Because the numbers keep rising, things keep evolving and changing throughout Canada, throughout Quebec, throughout the world, and so they're estimating in about 2 weeks we can get a good estimation on what is going to be happening in our area. So in the meantime, we have to maintain the course. I know it's difficult. I know it's hard for the people to say stay home, don't leave your home. Protect your physical distance, they're calling it now, rather than social distancing, making it clearer, physical distance. Don't interrupt your space. Live as a family unit. I know it's hard. Not visiting your elders. I know it's hard just to follow all the directives. But again, the stronger the measures we take now, the lessen the time frame that we'll be in this predicament. That is the hope, and that is the challenge that's for the whole community. Let's buckle down, let's do what we have to do now, and hopefully we'll shorten the time frame in which we are going to be in this current situation. Also, some of the numbers that came out today and overall across Canada, 86% of all new cases were due to community spread or community transmission. We talked about that last week, but basically what that really means is they cannot trace where you got the virus. Previously, it was easy to trace that somebody traveled, from a certain location and came back to the community or came back to Quebec or Canada, and then they developed symptoms, so they know where they traveled. So it was a direct link, or that link was with somebody who was directly associated or directly living with that person who had the virus. So it was easy to trace and easy to track. Now it's getting much more difficult because the vast majority of the spread is called community spread, and 86% of that is what's happening now. Much like the regular seasonal flu or the common cold that many of us get every year, you don't know sometimes where you caught it. Sometimes you could identify, well, I had my husband or my wife or somebody in my household had the flu, and then I got it. I mean, it's clear sometimes where you got it from. Other times, you have one person in the household who randomly gets sick, and nobody else in the household will get sick. Why that is, we don't know. But where that original person received it from, again, it's a question mark, because in the normal situation with the common flu, it's community spread, it's in and around all of us. So with that, knowing that, again, that there's that community spread, emphasizes and underscores the importance that we need to remain strong, remain vigilant, and the measures that we take. And I know it's hard. I know there's a major economic impact on the community, and it's extremely difficult to not go up to your grandparents or your parents and give them a hug and wish them the best. But it is for their best not to do that at this point in time, because we don't know who is carrying the virus, if the virus is on your clothes or yourself, maybe sick or in the process of developing symptoms and you're not fully aware of that. Like I said, economic impact is something that is obviously very strong in our community, but I ask you to think about it this way: what price do we put on a human life? If we take all these measures and at the end of the day we have zero losses in our community, I'll be very proud to be the first to stand up and saying everything we did was worth it, and I'm sure the whole community will feel the same way. So with that, I thank you for following through with all the recommendations which we're doing. Just a quick graph I wanted to show you here. I put a number on there, 4,162. That shows like the current numbers for today from the province of Quebec. And if you see the beginning of the month, there was virtually zero, and week by week it increased until you finally see last week where you see a very, very steep curve, and the numbers have been multiplying greatly over the past couple of weeks. But it's clearly from March 22nd to March 29th, we see an increase that is almost vertical. And like I mentioned, I think the other day, despite these graph and the way it looks, and certainly it's not a good graph to look at, it is still below some of the estimates that public health had predicted. So some of the measures, it's a little early to make broad predictions, but some of the measures we're taking now by reducing that community spread, by respecting our distances and taking these strong measures, it's helped slowing that at least a little bit for now. And as we move forward, I think it's gonna have a lasting impact. And again, we're gonna shorten that period of time in which we're all in this mess together, to put it bluntly. Over the past couple of days here at the task force, we received several inquiries, phone calls, and requests regarding about they want to hold various gatherings in the community to celebrate Kahnawake or to celebrate the fact that we're a united community. They want to celebrate birthday parties or whatever, and they're saying, well, are we allowed to do this? Are we allowed to do that? And no, the short answer is no. We're trying to minimize gatherings. unless you're with your essential service workers or unless you're with your family unit, you should be staying in that family unit and not mingling and gathering. Even though you may say, okay, we're going to do our best to maintain social distancing or physical distancing, we're going to have hand sanitizer and things of that nature, that may help a little bit, but it still does not totally eliminate the social interaction, the possibility of community spread. So at this point in time, we have to say no, these things are not permitted, and we cannot recommend or allow anybody to say, fine, go have a birthday party at somebody's house for a special occasion. It goes against everything that the medical people have been telling us. So we hate to be the ones to say no. Believe me, we don't take pleasure in doing that, but if we have to be up here reinforcing the message to Kahnawake, we'll do that every day if need be, because at the end of the day, I think I said by many people, we're here to save lives. We're here to ensure that our community gets through this as unscathed as humanly possible. Just a couple of other quick notes before I leave. Just a reminder, if you are a member of the Kahnawake Case Populaire, and you are having some difficulties on a personal level or with your business, you can contact them, and they will sit down with you and look at your situation on a case-by-case basis and see what they could do to assist you. Also, as mentioned yesterday, we do have our public safety inspectors, public health inspectors out and about in the community. So if making sure people are abiding by the proper recommendations for cleanliness and hand sanitizers and such. And as Joe Dalrymple mentioned a minute ago, the vast majority of people are doing an excellent job above and beyond, not having to be told what to do. But they're out there just to ensure if there's any questions that need to be answered, they're there to do that. As well, if there's a concern raised by a community member, we have inspectors that will be out there to go and address that concern. For the environmental health officers, again, 450-635-9945. And for our labor office for occupational health and safety, it's 450-632-9595. And as a matter of fact, tomorrow we'll be putting together a listing of all these key numbers, and we'll post it on the Facebook page so that it's easy reference for everybody. Now, we have these people out there, again, putting themselves out on the front lines to be able to ensure the safety of all. Mind you, if you see something that is an emergency, and by all means, the peacekeepers are still the route to go. If you think something is urgent, something's an emergency, pick up the phone, call the peacekeepers. As we all know, 450-632-6505. So before I end for today, I just want to give a quick shout out to Peggy Mayo. Thank you very much for the banana bread. It didn't stand a chance whenever we got here at the task force. Very good. Also, keep in mind, the frontline workers. It's not only the hospital peacekeepers and fire brigade and people of the task force. We're out there in the front, putting ourselves at greater risk. But it's also, the cashiers, the store owners, the people pumping gas. They're out there as well. They're putting themselves at risk as well to keep our community going. So a shout out to them as well. I know it's a difficult time, but everybody stay safe, stay strong. Onigawahe.
Right, now Lloyd, and that'll just about wrap it up for another edition of our daily COVID-19 Task Force daily update. Just a couple of quick notes. First of all, we've been talking about this last few days. If you have any medical questions, not specific to you, but about COVID-19, please send them to questions@mck.ca. And that will get to Dr. Annick Gauthier, and she'll be back here on Friday once again to do her update. She'll answer some of those questions. They won't be live. We won't be taking questions as they come. You need to send them in advance. So if you can do that, if that can help, please do so. Once again, questions@mck.ca. And just a quick note that while we've been doing this, and it is important, I think, people are working hard, including the people here, and it's nice that there is some appreciation. I know Jean Dybo, just who's one of our crew here, has just showed me some emails that came in, and just people saying thank you very much, keep doing what you're doing. So it's nice to know that the work is being appreciated, and we'll just keep doing it for you guys. So with that, until tomorrow, we'll be back with our next daily update as we change the month into April. So be safe, and we'll see you tomorrow. Nyauko adana wanigiwahi.